short-term memory loss. So yes, my goal is to help get people off of all those adverse side effects.
Well, Dr. Ward, you know, this is such an inspirational story, and we're very blessed. David joins us today, and he insists he's not a victim. He's a survivor. David, please come join us.
Amazing.
Looking good.
Thank you. Nice to meet you.
I was gonna say, I'm hanging out here with two GQ studs.
Look at this.
Pleasure.
Look at this.
Pleasure.
Color coordinated, too.
You know, and first things first, Dave, you go by Dave?
Yes, that's my legal name.
And you changed your name after this all happened. Why?
About 2 years ago, I changed it legally to Dave to liberate myself from my father and to establish myself as an artist. It was kind of like an artistic decision to do that.
And a lot of people will look at someone who's been burned and they think, okay, you know, physically, okay, I'm not seeing skin like I normally would on someone, but what a lot of people don't realize is what a toll it takes physically and the amount of pain. I wanted to talk with you briefly because one of the reasons we were excited to have you on the show is you're finally at a point in your life where pain no longer dictates it.
Almost. Currently, I'm undergoing a treatment called calamari, which is it's a machine that they attach and it has electrodes on it. What it does is it scatters the messages to the brain to shut off the pain centers in the brain in those areas. And it's absolutely amazing. It's changed my life for the better.
And it's helped control the pain. I wanted to bring in really quickly in this discussion on the phone Dr. Ward Wagner, one of Dave's pain management specialists. And Dave just described how his treatment has been helping him. Is this something that you're using more commonly in some of your chronic pain patients?
You know, we use this quite often for many different types of pain conditions. The conditions that respond the best are conditions that are what we call neurogenic or neuropathic. In other words, if there's current tissue damage happening, it's not going to be much help. But your neuropathy patients, your post-chemo, post-shingles, and now, of course, we've learned burn survivors, these kinds of people, this is tremendous for.
And this also, you can harken back to this. I think what's great about new treatment modalities is being able to pull back on use of sedatives and narcotics and other standard pain management treatments.
You're absolutely right. The people that I meet on a day-to-day basis are on so many narcotic pain meds, they're in danger for their lives. Their brains are like soup. They can't think straight anymore with short-term memory loss. So yes, my goal is to help get people off of all those adverse side effects.
Well, Dr. Ward, thank you for highlighting some of these new treatments. We really appreciate it.
You're such a role model, Dave. Talk a little bit, Dave, about the role of art as a therapy, especially for people who have been burned.
I think art is an expression that we all have. And whether or not I think we're all human beings and we all have different emotions and different feelings. However, we all have different challenges and different things to deal with. Currently, I'm showing at Joseph Watson Gallery and the Eden Fine Art Gallery in Las Vegas. And I'm just living the life of an artist and building a brand.
And is there anything before we go, Dave, that you want to leave people with?
I think my brand, it's lifted, and I created it to inspire others to live their life at an elevated level. And I believe that through doing that, we become healthier people and better individuals.
Wow. A true testament to living life in that fashion. Dave, keep doing what you're doing. Thank you so much for joining us today.